Thank you, Shiva. Good afternoon, everybody, and welcome to the first session. So, all of you have an very good attitude towards palliative care. That's why you are here today, and many of you might be knowing about palliative care. So, before moving on to the introduction as such, I would like to hear from you your idea about palliative care. So, any of you can unmute and speak.
Everybody, please unmute yourself and talk.
It's the starting trouble, so one can start and the others will follow. There is nothing wrong. It's always what we say is there is something that we can make it better. That's all. So please go ahead and speak.
Pooja?
Hi, good afternoon to all.
Good afternoon.
Myself, Pooja Malhotra. I'm from Delhi.
So, sir was asking, what is your insight about palliative care? So, what is your idea about palliative care? Please share your inputs.
Palliative care means to do or to help the individual who is in trouble, who is in pain.
Okay. Very good. Good start. Anybody else?
Good evening, everyone.
Good evening.
This is Mahima Bhattrai from Nepal. I'm working in Green Pasture Hospital, International Nepal Fellowship, INF, and I'm working as a nursing in charge in palliative care unit. In my organization, INF, it's been 15 years I'm working, but as a palliative nurse, it's only 1 year, but I have experience about caring palliative care in other ward also, general ward also with Dr. Ruth I'm working. So palliative care is all about providing quality care to patient with life-limiting illness and providing care to the family members also. Thank you.
Thank you, Mahima. You're right. So let's move on to the presentation. So we are planning to talk about palliative care like this. What is palliative care? Why is it needed? And a little bit of history about palliative care. And when should we start palliative care? Who should do it? How it is done? Okay. So let's start with the story of a patient. So suppose you see a patient like this. What's it that struck your mind by seeing this patient?
Patient is on pain.
Yeah.
He is depressed, frustrated.
Yeah. Yeah. There are many things which you can make out from this photograph. Patient has a tracheostomy. The skin around neck is black, probably due to radiotherapy. But you know, when when I project this picture, many people will first notice he has a tracheostomy, not his facial expression. But as palliative care people, we should be first focusing at his face. What does his face says? It is it says many things to us, but the most important, as you told, is that he is in severe pain. So he's a 54-year-old man who is diagnosed with carcinoma of the larynx, and he underwent radiotherapy, chemotherapy, and tracheostomy. But the main problem as of now is that he is in severe pain, and he says it is a continuous pain around neck, and he is unable to sleep because of pain. The pain is so severe, he is unable to sleep. It is 10 by 10, or it is very severe pain. Okay. He also complains of cough uh, and produces yellow sputum. There is fever, which is coming on and off. And sorry, there is an ulcer around tracheostomy. And this patient was brought to hospital by his 84-year-old mother because his wife left him after diagnosis of carcinoma of the larynx, and even children is not looking after him. So that's why the 84-year-old mother has come to hospital with this patient. So he when he came for the review, his doctor told him that he has recurrence of the disease, so they cannot do anything. You can go home and visit the nearby hospital if you have any problem. This is what the treating oncologist told him. So if uh, if you are the caregiver with this patient, what will you feel when you hear this sentence? Suppose you are the caregiver for this patient, what will be your feeling?
My feeling would be this treatment is not over, the patient is not healed and is not really well.
Okay. Anybody else?
There will be lots of question, prognosis, how it will happen.
Sorry, it was not very clear.
Magna, can you repeat again? Meghna, are you there?
That's okay. Senior.
Okay.
Anybody else? What will be your feeling if you are the caregiver for this patient? Okay, I'm not getting any. Sorry.
So you can continue, please.
Okay, so we can continue with this patient story. So let me ask you, what are the problems faced by this patient and mother? So all of you are nurses and you are looking after many patients. So please answer, what are the problems faced by this patient and his mother?
There will be more query about it, about the condition. Like there will be many questions, like what will be doing after this, after going to home.
Hmm.
they will be facing many problems.
Yeah. Okay, there are many doubts in their mind. What else? If you don't want to speak, please put it in chat. There is a chat option, you can type it. But I would like you to talk. Okay, I can see there are some. Jaka says has pain and depressed. I think that was the response for the previous question. Meenakshi says tracheostomy care. Yeah. Anything else? Is there any problem faced by this patient and family?
Any answers?
Salami says relieve pain. Emotional support. Sunita says emotional support. Lack of clear communication, financial issues. Yeah, very good. Okay. So what is the primary duty of a doctor? Is it to save the life at any cost? So this is the primary duty of a doctor. It is to mitigate the suffering. It is to ease the suffering. Cure, it is to cure sometimes, relieve often, and give comfort always. There exists no exemption to this principle. This is by Indian Council of Medical Research. Whatever be the condition of the patient, it is our duty to relieve or make the person comfortable as much as possible. So in this patient's case, whatever be the problems, we have to make him comfortable, isn't it? So this is what the ICMR says, make him comfortable. So how can we make this patient comfortable? How can we make him comfortable? Anybody?
So by counseling him.
Okay. Anything else to make him comfortable? What is his main problem?
By educating him about the consequences of treatment.
Yes. But what is his main problem? Why did he came to you?
Pain is the main problem.
Yeah. He has very severe pain, isn't it? That's why he came to you. What else are the problems? So you have to relieve his pain to make him comfortable, isn't it? What else are his problems?
Emotionally disturbed.
Yeah, emotional problems. Due to there are many reasons why he is in emotional distress. Okay. Somebody talked about the financial issues in the chat. So all those are problems which we have to relieve. Only then we can make him comfortable, isn't it? So can anybody tell me what is the definition of health by WHO? What is health?
Health is presence of physical, mental, and social and spiritual sectors, not merely absence of disease or.
Okay. So that's the definition of health. We have to provide, or it is the complete physical, mental, and social well-being, isn't it? And not merely absence of disease. So, if you take health in that true spirit, how many of us are doing healthcare in the true sense? Are you providing a true health to the patient? How many of the hospitals provides emotional support, social support, and emotional support for the patient? Just think about it. So we will see what are the problems faced by this patient and family. He is facing a lot of physical problems. We know the first and foremost thing or the distressing thing for this patient is unbearable pain, isn't it? He is in very severe pain and is unable to sleep. So that's the one of the most important physical problems faced by him. And he has a ulcer around tracheostomy, which is again causing pain. He has cough, fever, decreased sleep. These are the physical problems faced by this patient. But are there any other problems faced by this patient and family? So he has a lot of psychological problems or emotional problems, isn't it? So this patient was brought to hospital by his mother because his wife left him after the diagnosis of carcinoma of the larynx. So that itself is a cause of major worry, isn't it? And uh, he uh, he has an 84-year-old mother. So he's thinking, when my mother dies, who will take care of me? Or it might be in the other way. If I die, who is going to take care of my mother? So he also lost his role as a person in the family, and the cancer has caused disfigurement. You can see a tracheostomy. He has black skin. All this cause problems to his body image, which causes disfigurement. So which can create emotional problems. And he has lost hope in his life because the cancer has occurred, and he don't know how long he is going to live. So all these are the causes for psychological problems or emotional problems. Okay. And he has lot of social and financial problems because he and his mother are living alone. His friends are not coming nowadays. He is unable to go out, and because of that, they have isolation, and he is unable to go for any job. So there is loss of income. So all these social and financial problems, and in addition, he has spiritual problems. Spirituality is not only connected to God or religious belief, it is the search for meaning of life. Okay. And usually the people ask questions like this: why did God did this to me? Is there any God? Is this God's punishment? I have done all the good things for all the people, but still uh, this came to me. So all this indicates that patient has spiritual problems. So this patient has not only the physical problems, he has psychological problems, he has social and financial problems, he has spiritual problems. So which component is addressed in the hospital? When you take this patient to your nearby hospital, which component will get addressed? Anybody?
Holistic care.
No. Do you think the nearby hospital will take care of all the components of suffering in this patient?
Mostly we'll take care of physical one.
Yeah. So even you can see this patient who has gone to a tertiary care hospital where his treatment was taking place. Even they told him that sorry, we can't do anything. So even the physical care is not happening properly. So as you told, even if something is happening, it is in terms of physical care, or there will be relief of some physical symptoms. So I will show you a video, and please watch it carefully. I would like to hear your comments about this video. Is there anything which struck your mind? Anybody? Yes, Monica, unmute and speak. Senia, unmute Monica.
Monica?
Unmute her, please.
We lost her, sir.
Okay. Anybody else?
No,
Sir.
Monica is there. Yes, Pooja.
Sir, palliative care helps the individual, means the sufferer, the patient, and the family also.
Okay.
Salome?
So it struck me that they said it was the first time with palliative care that people were talking to the patient and not about the patient. So that makes a huge difference.
Yes. Any other points?
Basically, the impact of good IPR. Good impact of IPR, good IPR. If we have good communication with the patient, that's also a part of palliative care.
Okay.
So yes, the IPR, the good IPR is very important, I say.
So I'm not sure how many of you had her son. At first, he's talking about from a traditional point of view, we got good medical treatment, but what was lacking is good medical care. That was the first sentence he told. Is there a difference between medical treatment and medical care? Yes, Salome? And the next sentence were, all the doctors were seeing her as a case. And then his wife went on to say, not as a person. So is there a difference between a case and a person? So he brought about two words, treatment versus care, case versus person, isn't it? So medical treatment or case is something which is directed at the disease. Okay. So we have another word, disease versus illness. Disease versus illness. So now on the left hand side, we have treatment, case, and disease. And on the right hand side, we have care, person, and illness. Okay. So the treatment or case is focused on disease. Suppose you have squamous cell carcinoma of the cheek, and you have a lot of pain, you have an ulcer, you have emotional problems due to that, you have spiritual problems, but when you are treating, or when you are seeing the patient as a case, you are seeing the squamous cell only. You are not seeing that person. Okay, so that's the uh, or in case of medical care, or when you see as a person, you are seeing the squamous cell carcinoma of the cheek. You are seeing the person suffering in all dimensions: physical, psychological, social, financial, and spiritual. So that's the difference between treatment and medical treatment and medical care, or the difference between case and a person, or the difference between disease and illness. Okay, so we have to look at the patient as a person, not as a case. So in palliative care, we always look at the patient as a person, not as a case. So we have to see the whole person. That's the difference. Okay, so when we see the patients, we have to look at look at various dimensions of suffering: physical problems, psychological or emotional problems, social and financial problems, spiritual problems. Okay, so you can see that from the patient's photograph, you can see his face, which clearly depicts the physical problems. But this patient has lot of emotional and other problems which we are unable to elicit if we are unable to make a good friendship or a trust with the patient. So it's our duty to find out the emotional, social, and spiritual problems. And if you also find out the probable solution uh, for these problems, then only the patient's treatment will be, or a patient's care will be complete. Okay, and we will look at the evolution of palliative care definition. So this was the definition which was given in 1986. Palliative care is the active total care of person whose disease is no longer responsive to curative treatment. That means when a patient has a disease, suppose it is cancer, the patient will undergo all the cancer therapy. And when the cancer is not responding to treatment, then from that point onwards, you can start palliative care. That was the definition in 1986. But when it came to 2002, the definition has changed. It says it is an approach that improves the quality of life of patients and their families facing the problems. Okay, so just focus on the quality of life of patients and their families. How can we improve the quality of life of patients and their families? By addressing their pain and other problems: physical, psychosocial, and spiritual. Okay, and this definition continues to say that it is applicable early in the course of illness in conjunction with other therapies. Okay, so it is not like the previous definition. It says, suppose the patient has cancer and he is taking chemotherapy or radiotherapy, you can continue palliative care along with this curative or palliative treatment. So that's the difference between the 1986 definition and 2002 definition. And now there is another definition which has came in a Lancet Commission in 2017, which says palliative care should be focused to relieve the serious health-related suffering that is associated with life-limiting or life-threatening condition or end of life. So palliative care is for any serious health-related suffering. So you know that health has 4 dimensions: physical, psychological, social, and social, financial, and spiritual dimensions. So when the patient has problems, or if any patient has problems in this domains of suffering, the patient should be provided palliative care. Sorry. So I just want to tell you that from the beginning in 1986 definition, where palliative care is restricted only to those patients whose disease is no longer responsive to treatment. Now it has come to a point that palliative care should be given to any patient with serious health related suffering. Okay. And now I am going to talk a little bit about history of palliative care. Okay. So can anybody tell me which is the first modern hospice in the world? What is the name, year, and founder? You can unmute and speak. Or in the chat, you can provide your options. Anybody? Yeah, 1967. Shiba says 1967. That's correct. What is the name of the hospice? So hospice care is something which is usually used as a synonym for palliative care. Yeah, Cicely. It's Dame Cicely Saunders is the right word. And what is the name of the hospice? So this is the first modern hospice. Okay. And so St. Christopher's Hospice is the first modern hospice. And Dame Cicely Saunders, who was worked as a medical social worker, then changed her profession to nursing, and at last she became a doctor. So she is the founder of modern hospice medicine. Okay. Can anybody answer this? First modern hospice in India? Sinia, am I not audible?
You are audible, sir.
But Mahima says no sound.
I think Mahima's device has some issues.
Okay. Shiba says Gujarat, Mumbai. What is the name? That is the name of the hospice.
Shanti Avenda Ashram.
Yeah, it is Shanti Avedana Ashram. In which year did they start it? And who is the founder?
It's 1986.
Yeah, who is the founder? Okay, it is Shanti Avedana Ashram in Mumbai and founded by Dr. Louis Jos D'Souza. He was a surgical oncologist at Tata Memorial Hospital. Okay, so this is the first modern hospice in India. And which is the first community supported palliative care movement in India? First community supported palliative care movement. Where it started. So this is, it started in Kerala, in Calicut in 1993. And the organization is Pain and Palliative Care Society, Calicut. So that's the first community supported palliative care movement in India. And later this movement became the neighborhood network in palliative care. You might have heard about NNPC. That's the short form of neighborhood network in palliative care. And we know that in India, we have a umbrella organization for palliative care, which is known as Indian Association of Palliative Care. Which year it was formed and at which place? It is in 1994 in Ahmedabad. Okay. And it held its first international conference in Varanasi in January 1994. So this is a brief about history of palliative care, which we need to understand, especially for the palliative care movement in India. And you know that in Kerala, there are two doctors and one volunteer who spearheaded the development of palliative care. So it was started in Calicut when Dr. Rajagopal was the head of the Department of Anesthesia in Medical College. And his colleague Dr. Suresh Kumar and a volunteer Mr. Ashok Kumar joined that movement, which later went on to become a neighborhood network in palliative care movement. So this is Dr. Rajagopal, who is considered as the father of Indian palliative care. So who needs palliative care is the next question. And can anybody tell me who needs palliative care? So just look at this diagram, and many of you might have, if you look at institutions who are providing palliative care, those are mainly concentrated at cancer care, or patients who are suffering from cancer is getting palliative care. But if you look at the WHO statistics, it says 38 percentage of patients who suffers from cardiovascular disease should receive palliative care, followed by cancer, and then you can see respiratory diseases, and then HIV/AIDS, diabetes mellitus, kidney disease, cirrhosis of liver, Alzheimer's disease, and even multi-drug resistant tuberculosis, Parkinson's disease, rheumatoid arthritis, multiple sclerosis. So these are the variety of diseases who require palliative care. Why should they receive palliative care? Have you ever thought of why these people with cardiovascular diseases or pulmonary diseases should receive palliative care? So here is the statistics. You can see that there is a systematic review which was conducted in 2014 with 8 diseases. They compared advanced cancer, AIDS, chronic heart failure, end-stage renal disease, chronic, that is COPD, multiple sclerosis, motor neuron disease, Parkinson's disease, dementia. And they found that at least 50% of the patients have problems with pain, fatigue, anorexia, dyspnea, and worry. And we know that even in patients with cancer, one of the most common symptom is pain, fatigue, and many will have emotional problems. So which is also true in case of patients with non-cancer diseases. So we say that palliative care should provide relief for physical, psychological, social, financial problems. So likewise, we should also provide symptom control, and we should also be able to provide solutions for the psychosocial and spiritual problems of these patients. So just understand that the non-cancer patients with many types of disease, they also suffer from serious health related suffering. So we should provide palliative care to them. And we should provide palliative care. It is not based on the diagnosis. Okay. It is not based on diagnosis. We should provide palliative care based on the problems and needs of the patient. So as I told you earlier, many institutions provide palliative care based on the diagnosis. If the patient has cancer, yes, palliative care is provided. If the patient is bedridden, palliative care is provided. But if the patient is ambulatory or ambulant, palliative care is not provided. That's not right. If the patient has needs, then we should provide palliative care. If the patient has serious health-related suffering, we should provide palliative care. And even this notion of providing palliative care to patients with bedridden patients and cancer patients even exists in Kerala. They don't provide, or many of the palliative care centers may not provide palliative care to non-cancer diseases. So these are a few facts about palliative care. Worldwide, it is estimated that about 40 million people require palliative care. And out of this, 78% of patients are in low and middle income countries. Okay. And only out of this 40 million people, 40% of people are receiving palliative care worldwide. But what's the situation in India? How many percentage of patients are receiving palliative care in India? Any idea? Anybody?
78%.
78%? No. Anybody else? We are not up to 78%. It's very low. Any wild?
50%.
50? No. Come down.
Shika said 5. Sonia said 1 to 2.
Yeah. It's approximately 4%. 4% of Indians are receiving palliative care. So our situation is
10%.
no, it's about 4%. Okay. So that's the importance of this course. If you become an expert, you will be able to provide palliative care to our brothers and sisters, so that the patients who receive palliative care would be more. Right now, we only less than 5% of Indians are receiving palliative care. So it's very pathetic. So these are a few patients with cancer, neurological disorders, patient who is bedridden, patients with stroke. All these patients should receive palliative care. Okay, when should we start palliative care? What's the right time to start palliative care? Anybody? We already talked about this.
Any answers? Ashmita said after diagnosis. At the time of diagnosis, Sonia said.
Yeah. So I already told you that this was the previous view about palliative care. When the active treatment of the disease ends, then palliative care should start. This was the previous view. But now this is palliative care should start when a patient is diagnosed with chronic diseases. You can suppose the patient is diagnosed with cancer. You should undergo treatment for the cancer with chemotherapy or radiotherapy, but at the same time, you should be able to provide symptomatic and supportive palliative care. So palliative care should start from the beginning of such diseases. Who should do the palliative care? So for doing palliative care, there should be a medical team which consists of doctors, nurses, physiotherapists, social workers, and many other professionals. But in addition to medical team, we should have the community with us because most of the time these patients are in the community, and the medical team will not be able to go and see the patient in the community when they need. So most of the time the patients are in the community. So if you train the community or the volunteers from the community, they will be able to help the patient with their emotional needs, social and financial needs, and spiritual needs. But for the physical problems to address, we should have a medical team. So society has a very good role in palliative care, where they can help the patient in psychosocial, spiritual, and emotional suffering. Okay. And in addition, they will be able to provide a rehabilitation of patients and families. They will be able to provide educational support to the educational support to the children of the affected family. So so the community has a very big role in palliative care. And how are we going to provide palliative care? Through various methods. Widely, we can categorize into three: outpatient department, inpatient department, and home-based care. And in palliative care, this is the most important aspect of the care, home-based care. The team with the treating team, that is consisting of doctor, nurse, volunteer, physiotherapist, all goes to the patient's home and do the needful at the patient's home itself. So you can see in this photograph, there is a doctor, a nurse, and a volunteer who are willing to provide care to this patient. And these are some pictures. You can see the team is going for home care. And most of the things which the patients gets from the hospital, we can do it at patient's home itself, so that patient need not be transported into the hospital. Maybe changing a urinary catheter, putting a Riles tube, or even giving some normal saline infusions, etc. This all can be done at patient's home itself. So home care is a viable alternative for many patients who has chronic diseases. And one of the most important thing during home care is empowering the patient family to take care of the patient. So if the patient has a wound, we have to teach the family how to take care of this wound, so that they need not call any other nurses to do this care lifelong. So that's the most important thing in home care. So in short, palliative care is the symptomatic treatment, not a curative treatment. And palliative care is also known as total care because it addresses the physical, psychological, social, and financial and spiritual problems of the patient and families. And it should start at the diagnosis of chronic diseases. In addition, we should provide bereavement support. What is bereavement support? It is mainly the emotional support provided for the family when the patient is dead. And then when the patient dies, the family will be in distress. They will not be able to cope with the loss. So the palliative care team goes there and provide emotional support to the patient, to the family. And that's what bereavement support means. And as I told you, it is not in real sense, palliative care will not be complete unless there is involvement of the community. So it should be provided by not only by the medical team, it should be provided from the community, along with the community. And I will end with this. So you can see a patient who is sitting with 3 pillows because of very severe pain and breathlessness. And this patient was brought to us, and we provided a tablet morphine. And you can see after 30 minutes, he is able to remove 1 pillow, and he is able to take a sip of water. And after about 1.5 hours, he is smiling at us. So we can make this much difference in the life of patients and families. So this is the patient whom we saw at first. And the most important thing is that palliative care, when you see all the people who are taking care of this patients, it is provided with love, isn't it? So that's the basic of palliative care. And I think I will show you another video, and we'll finish the session with that video. So thank you for watching that video. And if anybody has any comments or questions, you can ask now.
Any questions? Sir, no questions. Can we move on to the patient story?
Okay.
Good afternoon to all. I am Reshma, working as a session head in home care nursing services at Pallium, India. Today I am presenting a patient story of 39-year male diagnosed with traumatic quadriparesis with stage 4 pressure sores on sacral region and left gluteal region. And about the presenting complaints of the patient complains of constipation, 2 days, and he is having multiple pressure sores over the sacral region and gluteal region. About the pressure sores, warmth and tenderness present, exudates present, tunneling present, and the bed sores are irregular in shape, also foul smelling. And also complaints of moderate pain over the hip region, urinary leakage also present. About the history of illness, he had history of fall while carrying weight, followed by neck pain and weakness of both lower limbs, and was diagnosed with traumatic quadriparesis in August 2015. And patient got admitted in nearby government hospital and treatment taken from there and discharged after 1 month. After 6 months, he developed a bed sore over the sacral and gluteal region, and it was stage 4. And also complaints of pain over the hip and wound side for more than 2 weeks. And in the hip region, the pain score was 5/10, intermittent in nature and burning type of pain. And in wound side, the pain score was 4/10, continuous in throbbing type of pain he is complaining. Due to this pain, sometimes they keep the wound open. Sleep was disturbed due to this pain, and also oral intake decreased. And in examination, patient was conscious and oriented, and all the systems are within normal limit. And after admission, treatment and significant investigations, we done routine investigations for this patient, and most of the parameters are within normal limit. And next is about the psychosocial and spiritual aspects. 39-year-old unmarried man living with his 65-year-old mother in a rented house. He has one sibling and he is married and living separately and not caring and helping them. Before diagnosis, he was a manual laborer and was the breadwinner of his family. Now, his mother is a manual laborer and she is taking care of him. And now the main source of income is from mother's daily wages, her pension, and some of his friends. And for the treatment purpose, they have taken rupees 1.5 lakhs from private finance bank also. They are devout Christians and now unable to go to church. This makes him very sad. And he communicates through cell phone and he says to his mother like, I don't think I can walk. So please don't spend money over my treatment. And the main concerns in the story is pressure sore, pain, and financial problems. And in summary, 39-year-old man with traumatic quadriparesis with bed sore present over sacral and gluteal region with pain over the hip region. And the main discussion points are, do we need to provide palliative care for this patient? And the second one is, what are the problems faced by this patient? And last one, what all can be done for this patient and his mother? Thank you. Thank you, Reshma, for the excellent presentation. Anybody need any more clarification regarding this patient story? Please ask her. So otherwise, we can move on to the discussion points. I think nobody's need any more clarification regarding this patient story. The patient story was clear. So the first question is, do we need to provide palliative care for these patients? What is your answer? Do you think this patient needs palliative care?
Yes, ma'am.
Yes.
Yes.
Ma'am.
Why do you say yes?
Patient and her mother need some psychosocial support regarding their spiritual belief, because they are not going, and son is refusing for treatment, asking mother not to spend money on him.
Okay. Any other answers?
Maybe for the well-being of the patient and support, like he need the patient need overall holistic support.
Okay.
The lady is very old and she cannot do many things, so they need help.
Okay. Vishaka, do you want to say something?
Ma'am, the lady is too old and she cannot do many things like taking care of him and also like financial. They have problems, so they need help, somebody to help them.
For good quality of life.
Okay. Next. So, as you all said, definitely this patient need palliative care because this is the life-threatening illness. He is having a serious health-related suffering. So he need lot of care. Our main aim of palliative care is to improve the quality of life of the patient and their family. So and also we understand that the palliative care is not only for the cancer and end of life care; it's for all health-related suffering. So we can move on to the next question. Please. So what are the problems faced by this patient?
Ma'am, as a patient is spinal cord injury patient,
Okay.
he is not able to move, and he's having bowel and bladder issues also.
So when you talk the problems faced by the patients and families, please group it into physical, psychological, social and financial, and then spiritual problems. So can you come up with what are the physical problems faced by this patient and family?
The patient is immobile as he's having spinal cord injury.
Yes. What are the other physical problems?
Pressure also.
Yes, pressure source.
Pain.
Pain. Constipation.
Bladder injury.
Urinary leakage.
Okay.
Yeah. So those are the some of the physical problems in this patient. What are the psychological problems?
Inability to adjust with the diagnosis.
Yes.
Emotional, lack of emotional.
So, okay. Anybody? Anybody else want to comment on the emotional problems of this patient?
Frustration.
Yes, frustration. Isolation. That's a social aspect. Yes, so isolation.
Loneliness.
Yes. No help from society. He has no hope. Yeah, that is coming into the emotional problems or psychological problems. Then fear of death, again in the emotional problems.
Our discussion point was, what are the problems faced by this patient? Already said that he has physical issues such as pain, bed sores, urinary leakage, insomnia, loss of appetite, etc. And he has some spiritual issues also, and feeling of being burdened to the caregiver. Financial issues are there, social isolation, loss of independence, loss of job, anxiety, depression. These are the main problems faced by this patient. And the third discussion point was, what all can be done for this patient and his mother?
To give
Rehabilitation.
What kind of rehabilitation you mean?
Like as he's having spinal injury, so physical rehabilitation can be done for the patient, and emotional support for both the patient and his mother. Then how long-term care is needed for the patient. So like home care when the medical team came to the home and treat the patient based on the need, like that.
Okay, thank you.
Thank you, ma'am.
Any other points?
to give a spiritual support to the patient and his mother.
What you will do for his spiritual support? Take up. So now we understand that he has some spiritual issues, not able to go to church. Okay. We can't hear you. Your voice was breaking.
We will pray for the patient and his mother and entire family.
Still your voice is not clear, not audible. So please put your answers in the chat box so that we can able to see your answer. Any other answers? So now we understand that palliative care is not only for the patient, it's for the family also. So we need to help his mother also. So Meghana, do you want to say something?
No, ma'am.
No. Okay.
Home visits.
Okay. If possible, we can able to provide home visit for this patient. Okay.
And the family education is needed because we can teach about the bedsore dressing that it can cut the cost.
Okay. Yeah. It's very good. If the relatives or this patient mother is able to do the dressings, we can train the caregivers. Okay, we can train his mother about how to do the dressings and how to prevent pressure sore. Okay. Okay. Most of the points we discussed. We know volunteers are the vital part of palliative care. So there is a need to mobilize the community volunteer support from their community for regular visits and fund generation if possible. And we can provide vocational rehabilitation for the patient and for the mother, and empowering the mother to take care of daily care of him, like position change, bedsore dressing, etc. Then the mother is the only one caregiver. So we can provide any respite for the caregiver for few days. Then look at the health issues and emotional issues of the caregiver and convey that we care. Like that, in these ways, we can help this patient and his mother. So here we have provided like a vocational rehabilitation. We have provided a poultry farm for this patient, and also that his mother is having a lot of problems, hypertensive also. We are providing her medications also. So that way we can always we can think about the patient side and the family member, the caregiver side, and give support to the to them. Sir, any point you want to add?
Not really, but palliative care, when we most of the healthcare workers will be focusing on patient mainly. So the caregiver is usually out of the scene. We may talk to them, but we will not explore the problems of them. But as you know, palliative care is not only for the patient, but also for the caregiver. We should be ready to explore and try to solve their problems. So caregiver also comes into the picture of palliative care. Yeah. So I want to stress on that point.
Thank you, sir. So anybody want to add any points? Okay, we can wind up the session. Today we have learned the many the points. As sir said, palliative care is not only for the patient, it's for the family. It's a total care. We need a teamwork, and the palliative care not stop the patient is death. After death also, if we want, we can continue continue palliative care as a bereavement support, and also you can continue you can give rehabilitation. You can think about the rehabilitation also, like physical rehabilitation, vocational rehabilitation, and educational rehabilitation also. So we need a teamwork and we need a community support also. Also, we learn from the patient story. The caregiver support is very, very important. Without caregiver support, we can't do anything. So always remember the patients, the caregivers trust, and support them as much as possible. Okay. Thank you. Thank you, sir, for the excellent presentation. Thank you, Reshma, for the excellent patient story presentation. Thank you. See you next time. Thank you. Thank you, doctor. And thank you, Shiba ma'am. Before winding up, I have a few things to remind you.